I am Dr. Jay Hitson, Clinical Director of Blue Umbrella Medical. We are innovative integrated health solutions. We have a medical center here in beautiful Murfreesboro, Tennessee. One of the things that I get asked a lot is we work with a myriad of different issues and problems and diseases, and a lot of our patients and our other partners out there, they like, what pulls us all together? How do you decide on some of these different therapies? Because we do everything from work with neuropathy to stem cell recruitment for arthritis, to working with hair loss, to stress incontinence, to diet and weight loss. And it's just so many things. The list goes on. And it's what is really interesting to me is actually it all goes together. And let me explain to you why we do what we do. Well, first of all, we are targeting conditions that are common. Heart disease, type 2 diabetes, obesity, arthritis, those are extremely common conditions. Anxiety, depression, even recently, again, we're bringing on stress incontinence for women. Those are very, very common disorders. So we're always looking for ways to address the big issues. Now, we don't really have as many protocols for some of these more rare disorders. It's just not our niche, and that's not where we're going. But for the most part, if what you have is something that thousands and millions of other people have, then chances are, if we don't have a protocol for it, we're looking for one. Now, the second thing is chronic. We are really not into acute conditions. The ERs, your urgent care centers, they're amazing with urgent. So if you've just recently if you fell and you have a broken bone, go to the emergency room. Anything that is over 90 days, it's been lasting more than 90 days, that's our wheelhouse. If it's brand new, and here's the thing is, again, one of the reasons we don't want to really get into acute care is because most things just get better on their own. So if you just rest and take good care of yourself, a lot of things will honestly be fine within that 3 months, 90 days, 12 weeks anyway. So that really takes away the challenge for us. So we really want the chronic conditions, the things that have not gone away for 3 months, 3 years, 3 decades. Now, the interesting thing about our center that's very different from most medical centers is we only engage in treatment protocols that actually reverse the problem. We will not mask or manage sickness and disease. So we do find these really, really unique ways at targeting the things that are bothering people most. Again, so we're not going to put somebody on a bunch of medications for their type 2 diabetes. We're actually going to work to reverse their type 2 diabetes. We're not going to simply give somebody a steroid injection for their arthritis in their knee. No, we're going to reverse the damage in the knee using a lot of different protocols. And the list goes on and on. We're not going to we're not looking to manage anything. We want solutions. And that's just what we're about. So for the most part, the real other factor is also has to be very safe. And so what's interesting between having that criteria that it actually has to reverse the problem and it has to be safe, a lot of pharmaceutical interventions really just won't make the cut. So we end up naturally becoming natural. It's not that we're trying to be necessarily non-pharmacological. It's just that the drugs don't make the cut because they're masking, they're managing, and frankly, a lot of times their effectiveness rates don't make our criteria either. Which, by the way, we have a criteria. So first of all, 30% of things are going to get better all on their own, placebo effect. All right. So you can give somebody a sugar pill and 30% of people will get better. So when we're brought some of these different protocols or, we're seeing some of these new technologies and they're like, oh yeah, 1 in 3 people, they get better. Well, 1 in 3 people will get better anyway. So that's a no-go for us. 50-50 is just not exciting. There's too many things out there that are 50-50. So we just stay away from those. Not that those aren't good, and not that we discourage people from trying that. We're just not going to bring it here. We're just not going to put our name behind something that only has those rates of actually effectiveness. So 70% is kind of like our bare minimum. 70% of the people have to get better. Now, that doesn't mean 100%. There's a lot of limitations to matter, but 70% of the people have to be reporting or showing on x-ray or showing on blood panels or whatever that they are improving. Now, we will consider it 70%, 80%, yes, that's a definite go. We're pretty excited. 90% and above, we're ecstatic. So, and it's really fascinating how many of the different protocols and procedures that are out there that are just not making it into mainstream medicine that do meet these criteria. And that's pretty exciting. We're constantly going to conferences and doing research and working with a lot of other professionals and providers that are outside of our scopes of, learning what they're doing, and always trying to stay on that leading edge, because innovation is just a core value here at Blue Umbrella. So even though it may seem like we have all of these different things and that they're disjointed, they're not at all. It's always addressing something that's common, chronic. It can reverse the disorder, and it can be safe and effective at the rates that we hold our standards to. So that's Blue Umbrella. That's what we're about. And we love helping people. And because of the unique nature of our facility, we can actually regulate how we feel people should be treated. And I think that's what every physician wishes for their practice, and we're the blessed few that actually get to do it the right way. So I'm Dr. Jay Hitson at Blue Umbrella Medical.